We know addiction is a very stigmatizing disease. Many people don't want their neighbors to know or their employers to know, and that's why we set the office up as a private physician's office, very little signage. People come in, they get treated as individuals, they get treated as patients, not drug addicts standing in line. Most patients are very scared when they come here initially, but most of them feel better in 3 to 4 days. And after that time, they're just wonderful. They love the treatment. It's not intrusive into their lives. They're able to go about their lives and still get their treatment here. And they just feel fine. Many times, it's the first time that they felt okay in years. Successes here are wonderful. We really feel like we're giving people their lives back. They come in and they're struggling. They come in, they feel sick. They can't function. They can't get through day to day without taking narcotics or drugs. And we give them medicine which curtails their cravings and lets them get back to their lives. The Bel Air Center for Addictions is a private physician's office. We treat people like patients, not drug addicts here. They can see physicians in a private office. They get treated with respect and courtesy, and they get treated with medicine that they can get filled at a pharmacy rather than standing in line at a methadone clinic.
Who are?
The Bel Air Center for Addiction is a private physician's office. We treat people like patients here. They can see a physician and they can get treatment in the privacy of a physician's office. There's no lines, there's no sign-ins, there's no stigma. I realized that there was a big problem of addiction in our community and it was being undertreated. And I decided that it would be a good idea to open up a center for addictions where we addressed the real nature of addiction that people didn't understand, that it's really a common problem in the community and not just limited to the homeless people living in the streets in Baltimore City. Here at the Bel Air Center for Addictions, we're really promoting that people be treated as outpatients in their community, in their families. We provide medicine to curtail the urges for them to use drugs or alcohol, and we give them an opportunity to continue in their lives without having to go to a 28-day treatment program and without having to go stand in line at a methadone clinic. I realized that addiction was an undertreated and underrecognized disease in our community. Many people would not go to a 28-day treatment program. Many people would not go to a methadone program, but they might come to a physician's office and openly discuss their addiction problem. I love taking care of patients that maybe haven't been treated well in the past. It's great to see them get better very quickly. It's great to give them a second chance in their lives, and it's just very satisfying. They're very grateful, they're very appreciative, and it's great to come in and be able to do this every day. Addiction is definitely a genetic disease. We've known that for many years. People's brain chemistry is wired from the time they're born. We know that depression runs in families, we know that schizophrenia runs in families, and we know that addiction runs in families. If someone is born and their brain is wired to be susceptible to various addictive drugs, if they get exposed to those drugs, they can be at a very high risk of developing an addiction. If I knew that you were at high risk for developing an addiction because of your family history and you had to take painkillers for your back problem, I'd be very cautious about using certain types of narcotic medications. If narcotic medications needed to be used, we would need to use them for a very limited amount of time, and we needed to monitor them, and we would need to monitor them very closely. It could be possible that if you continue to take narcotics for a uncertain period of time, if you continue to take narcotics for a prolonged period of time, you could develop an addiction. And I've had many patients who have developed inadvertent addictions because of pain issues. No, addiction is very common in all our communities. It's not just the celebrities that are addicted, and it's not just the people living on the streets in Baltimore who are addicted. It's many people who are living in our community, who are working in our community. I would think that many of us have family members or friends who we believe have an addiction problem. Most of my patients are professionals. They're working, they have jobs, they have families, and they got caught up in an addiction problem, and they're trying to keep their lives together.
Okay.
I primarily am seeing opioid addicts, people addicted to narcotic pain medicine. That's because that's such a devastating addiction that people are really unable to function in their lives without treatment. After that, I see a lot of people who are suffering from alcohol addiction. That's very prevalent in our community. Often people are able to function at a higher level, but they still have significant problems that we're able to help them with.
Okay.
These people are people that are living in the community. Your neighbors, my neighbors, they're nurses, electricians, carpenters, professional white-collar workers. They're everybody, people that you wouldn't suspect of having an addiction problem.
And where have they gone in the past for treatment?
Most of the people that I've seen, some of them have been through 28-day treatment programs and they found those ineffective. Some of them have gone to 12-step meetings and have found those ineffective. Many of them have not sought treatment at all because they were afraid of having to go to one of those programs or something like a methadone clinic.
What about the success rate?
Most of my patients are people that live in the community. They're professionals. They're nurses. They're CEOs of companies. They're electricians. They're plumbers. They're people that live all around you. They're your neighbors and my neighbors.
What would this patient that comes here to the Bel Air Center for Addictions?
Most of the patients who come here are professional people who have jobs, who have families. They're struggling to keep their lives together because of their addiction. They're unable to take 28 days off to go to an inpatient program. They're not appropriate to go to a methadone clinic program. They need to get treatment from a physician in the privacy of a physician's office in their community.